President Trump reversing course and extending social distancing guidelines until the end of April. It comes after doctors on his pandemic task force warned that with the current precautions, even with the current precautions, the death toll in the United States could reach 200,000. Joining us now was one of those doctors, Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, thank you for getting up early for us. Thank you for all of your doing. Let me just ask you right away, why have the guidelines been extended till the end of April? Why was that decision made?
Well, John, when you look at the kinetics of the outbreak, the patterns that are going on now, even as we speak, they were not going to reach a peak and turn around the way we wanted to within the time frame that was originally estimated. So I thought it was prudent and I think the right decision to extend them another 30 days. Because what you really want to do is you want to start seeing some flattening out and turning around of the curve and it coming down. It wasn't doing that. If you look at New York, it was doing this. If you look at New Orleans, it was doing this. Detroit is certainly going to start doing that. It would not have been a good idea to pull back at a time when you really needed to be pressing your foot on the pedal as opposed to on the brakes.
You keep talking about the peak. Can you explain to the American people what exactly that peak looks like and how it will tax the system?
Well, there are a number of factors that are going on at the same time. One is the number of new cases per day. The other is the number of deaths that you have. So if you have like 100 cases today, 200 cases tomorrow, 400 cases the next day, 600 cases the next day, you are clearly going in the wrong direction. You don't want to interfere except to try and suppress that. If you reach the point where the number of new cases start to equilibrate, so that yesterday you have 150, today you have 150, tomorrow you have 125, they're starting to level off, which is the kind of the beginning of the turning around of the curve of it coming down. Deaths tend to linger a little bit more after the hospitalizations, but when you see the new hospitalizations start to do this, you know you're going in the right direction. And we weren't doing that. And we felt that if we prematurely pulled back, we would only form an acceleration or a rebound of something, which would have put you behind where you were before. And that's the reason why we argued strongly with the president that he not withdraw those guidelines after 15 days, but that he extend them. And he did listen.
You argued strongly, you said, with the president. Our reporting is that, among other things, you showed him these models that suggest that even with the current guidelines, the death total in the United States could be between 100,000 and 200,000. So why do you think that was so convincing?
Well, it was quite convincing. I mean, the president, his first, as he said multiple times at the press conference yesterday, his first goal is to prevent suffering and death. And we made it very clear to him that if we pulled back on what we were doing and didn't extend them, there would be more avoidable suffering and avoidable death. So it was a pretty clear decision on his part.
How much convincing did it take from you?
How much convincing? You know, interestingly, we showed him the data. He looked at the data, and he got it right away. It was a pretty clear picture. Dr. Debbie Birx and I went in together in the Oval Office and leaned over the desk and said, here are the data. Take a look. He looked at them, he understood them, and he just shook his head and said, I guess we got to do it.
How important was it for you to make this case when you made it? Because we'd been, I guess, 7 days into we can't make the cure worse than the disease, an aspirational goal to open by Easter. So how important was it for you to go in and make that case? I guess it was just yesterday.
Well, it was very important because from a public health standpoint, we felt strongly that it would have been the wrong decision to pull back. I mean, we are scientists, physicians, public health officials. We're not economists. We're sensitive to the idea that the economy could suffer. But it was patently obvious, looking at the data, that at the end of the day, if we try to push back prematurely, not only would we lose lives, but it probably would even hurt the economy. So you would lose on double accounts. So to us, there was no question what the right choice was.
You've been in a position where you've had to talk about modeling to lay people probably more than you would ever like to. And I know that you make the case that models are only based on your best assumptions, but just so people understand exactly what you're saying here with this 100,000 to 200,000 death estimate, is that even with the measures we have in place now?
Yeah. Yeah, that was it. That was a varying degrees of implementation and success of the methods. I believe, looking at the dynamics now, that if we really do pull a full press on the mitigation, and importantly, if we get the areas that are spiking now, New York, New Orleans, maybe Detroit, get them under control. But as importantly, there are a number of areas in the country that have relatively few cases. Those are the ones that are vulnerable and dangerous to go along and then spike. So at the same time that we're concentrating on the ones that we're mitigating, the New Yorks, the New Orleans, you've got to look at those other areas and make sure you very vigorously identify, test, concentrate, get individuals who you take out of society because they're isolated, and do contact tracing. If you just look at those and say, there are very little infections in this area or that area or that area, we don't have to worry about it. You're making a big mistake because those are timbers that can turn into big fires. So you got to do both. You got to mitigate the ones with obvious trouble, but you got to stop the ones that are starting to spark.
And even with that, you think 100,000 deaths is a reasonable projection at this point?
I think, you know, if you look at seasonal flu, we had a bad season in 2017-18. We lost over 60,000 people just in a seasonal flu. This is clearly worse than that. So I would not be surprised. I don't want to see it. I'd like to avoid it. But I wouldn't be surprised if we saw 100,000 deaths.
You talked about New York, New Orleans, Detroit. Any other cities you're specifically concerned about this morning?
Well, you know, there are cities outside the New York area. For example, the cities in New Jersey, you know, Newark and places like that. In Connecticut, Fairfax County, Greenwich, Los Angeles, perhaps. Cities in the Midwest, some of the larger cities. Those are the things we get concerned about. Because thus far, they seem to be doing well, but they have the potential to get into trouble.
What evidence have you seen that supplies are disappearing from hospitals at unusual rates? The president said something that got a lot of people's attention, that hospitals that normally order 20, 30,000 masks were having to order 200, 300,000, and then suggested they're walking out the back door. What evidence have you seen that these masks may be walking out the back door?
You know, I have not looked at that carefully, so I really can't comment. I mean, it could be that there are many more patients there that need them, and they're actually not walking out the door. They're actually being utilized. I don't know. When that discussion came yesterday, I really didn't know what was going on, so I'll have to check that out later and find out what they were talking about.
In terms of public health, one of the most important things in a public health crisis is public trust. How important is a consistent message in a public health crisis?
Well, it is important. That's the reason why, if you go back and take a look at the things I've said over the last several weeks, they're really rather consistent. I mean, almost word for word.
Right.
Sometimes as we get more cases, you know, I get a little bit more emphatic about what we should do, and that's the reason why I made a big pitch to do a couple of things over the last couple of days. One,
do you feel that
to not quarantine New York.
Do you feel that every official speaking at a microphone has been as consistent as you have been over the last days and weeks?
No. You know, not everybody's the same. People have different styles about how they communicate.
Testing right now. New York City, or New York State, I should say, is developing or has developed a test that can be taken with saliva and a nasal swab, a self-test. How important is this to battle the coronavirus?
You know, I think it's very important, because what you want, if you're going to immediately identify, isolate, and contact trace a person so that you could quickly get them out of society and stop spreading other people. You want to test that you know the answer right away. One of the problems with tests that you get back several days later is that you generally let that person who might actually be infected to go back into society and inadvertently be infecting other people while you're waiting for the result of the test. So if you really want to do what I mentioned just a moment ago, is to really get the handle on those areas where they don't have a lot of infected individuals, where you want to effectively identify, isolate, and contact trace. You want the result of the test in real time. You want to know exactly what you're dealing with at the time you're dealing with it.
In terms of the other tests on some of these drugs for treatments, can you give us an update on what you're hearing, how effective they are?
Well, you'll never know if a drug is really effective unless you compare it to something, and that's called a randomized controlled clinical trial, where you can compare drug X and standard of care with just standard of care alone. We have a test of a drug called remdesivir that's undergoing a randomized controlled trial. We have about 200 people in that trial. Hopefully in the next few weeks to a month or so, we'll be able to get data that will give us a definitive determination as to whether or not the drug works and whether or not it's safe.
Dr. Fauci, just in the last few minutes you've been on with me, I've been looking down at my email and my Twitter account, and there's so many people writing in, first of all, grateful for the work you're doing, but also frankly concerned with how hard you're working. You know, you're talking yourself hoarse like many of us do on TV. So how are you doing through all this in this hard work, and what do you want to tell the American people about your own health and well-being?
Well, I'm fine. I'm healthy. I'm tired. I don't get nearly enough sleep as I should. This is not my regular voice. I'm constantly briefing people, talking, testifying, doing interviews. It's a long day. I mean, I work pretty much hours anyway, but I'm getting only about 4 or 5 hours of sleep, mostly 4 hours of sleep a night. There's a lot of things to do. When you're working in the White House, it's a very, very busy place.
Well, we're grateful for the work that you're doing, Dr. Fauci. We're grateful for your consistent message. Thank you for coming on this morning and telling us the things that you have seen and what you need to see going forward. Appreciate it, sir.
My pleasure.
This morning, the death toll in New York State is nearing 1,000. Hospitals are reeling, with New York City's mayor warning they will run out of supplies by this weekend. Now, because of the nature of this pandemic, just how contagious it is, just how fast it moves, and plain technical challenges, we really haven't been able to show you what this crisis looks like on the front lines. That's about to change. CNN has an exclusive look inside a Brooklyn hospital on the front lines of this pandemic. CNN's Miguel Marquez joins us now. And look, Miguel, you and I have both been in actual war zones. The descriptions you give as to what you have seen inside these hospitals, reminiscent to me of actual war zones.
It's funny you say that, because all along in this pandemic, that is what I have been thinking about, whether it's Iraq or Afghanistan, in many, many ways, not just the hospitals. But now that I've been to one, certainly the hospitals. We were invited to Brookdale Hospital in the Brownsville area, the neighborhood of Brooklyn. It's largely African-American. It's largely Latino. It's also one of the poorest in the city. On a normal day, they have plenty to keep them busy, but coronavirus has pushed that hospital to the edge.
Every corridor, every corner, every ward.
Bring the juice. Bring the juice.
Every inch of Brookdale Hospital Medical Center in Brooklyn now inundated with those suffering from COVID-19.
What are you looking at on a daily basis? How difficult is this?
Well, this is a war zone. It's a medical war zone. Every day I come in, what I see on a daily basis is pain, despair, suffering, and healthcare disparities.
Through Sunday afternoon, Brookdale said it had at least 100 confirmed cases of COVID-19, with nearly 80 awaiting confirmation. More than 20 people have died so far from the disease. On top of its normal emergency flow, coronavirus is pushing the hospital to the max.
We are scared too. We're fighting for your lives, and we're fighting for our own lives. We're trying to keep our head above water and not drown.
Doctors, nurses, even those keeping the floors clean face a rising tide, uncertain how long it will rise, unsure this coronavirus won't sicken them as they struggle to stay a step ahead.
What do you need right now?
We need prayer, we need support, we need gowns, we need gloves, we need masks, we need more vents, we need more medical space. We need psychosocial support as well. It's not easy coming here when you know that what you're getting ready to face.
The deaths here keep coming. While filming, another victim of COVID-19 was moved to the hospital's temporary morgue, a refrigerated semi-trailer parked out back. The hospital's regular morgue filled to capacity.
How much room do you have in your morgue?
Usually we have around 20 plus bodies that we can fit comfortably.
And you've gone over that.
Going over that, and the state has been gracious enough to bring us apparatus to help keep families and keep the bodies in comfortable areas because we didn't want bodies piled on top of each other.
Brookdale needs more of everything. Today, Edwards said the hospital has 370 beds. They'd like to add more, many more. 2 weeks ago, this was the pediatric emergency room. Now it's dedicated to victims of COVID-19. Plastic tarp taped to the ceiling, offering some protection and a bit of privacy. The intensive care unit filled nearly to capacity and sealed, so fewer doors and less traffic than usual comes and goes. This window is the only place where family members can watch their loved one inside the unit as they chat with them via cell phone. It's sometimes as close as they can get as COVID-19 takes another life. As grim as it is right now, Dr. Mollett expects it will get worse.
It could end in the fall, it could end at the end of the year. But this is why we're begging everyone not just to only put that pressure on the emergency department, but also for everybody to help us to help them by staying home.
You think we're in it for the long haul?
Oh,
This is months, not weeks.
Definitely.
Another worrisome thing she's seeing coming through the doors, not just the elderly and those with compromised immune systems.
I work at 2 hospitals. So I work here in Brooklyn, and then I work at another hospital in the Bronx, and it's the same thing. In the South Bronx, it's the same thing. I've had patients that were in their 30s, and they are now intubated, and they're really sick. I've had patients that are well.
No underlying conditions.
No underlying conditions. So the thing is about between life and death, as far as this coronavirus, is that this virus there's no difference. It has nothing to do with age, has nothing to do with lack of access to health care, has nothing to do with socioeconomics, race, or ethnicity. This virus is killing a lot of people.
Brookdale has one advantage. Hospital officials say it can do rapid testing for coronavirus on site, its own lab. Right now, up to 300 tests a day. They hope to get to 500 a day.
And right now we have about 52 specimens in here. We're about to that we're preparing to test at the moment.
The hospital following Centers for Disease Control guidelines on who gets coveted tests. Patients admitted for possible coronavirus, healthcare workers showing symptoms, and symptomatic long-term patients. Each test a laborious and time-consuming process.
It's very easy to make a mistake. Very easy, just from an extra milliliter of reagent. Adding it to the machine can mess up the entire batch. All the 52 specimens, we would have to start all over from the beginning.
ER doctors are used to stress. Dr. Mollett says she has never experienced anything like this.
I don't really sleep that well at night. I worried about my family. I worry about my safety. I worry about my colleagues. I worry about how the shift is going to be the next time I come. I worry about if a family member is going to come and be a patient as well or fall victim to the coronavirus. I worry about a lot of things.
The disease, a marathon that healthcare workers alone cannot win or even finish.
It's not up to just only to the emergency department to pull through and to make sure the curve is flat. And this is a responsibility for everybody in the country to help us pull through. So
stay the F home.
Exactly. I'm very.
Is that literally? I mean, how?
Stay the F home. Exactly. Because it's not just us that has to help flatten the curve and take care of everybody. Help us help you.
She says it will take everyone pulling together. The worst days, she fears, are still ahead.
Hang in there. Now, what's maybe even more shocking is that all of those individuals that we talk to and others that we talk to off camera, they have special arrangements just for their own lives. They come to work every day. When they go home, they can't actually go home. They have to Skype with their family. They have to live in a different location. The lab technician we talked to hasn't seen his girlfriend or his daughter for 2 months, at least in person. Everybody giving 110% at that hospital, and certainly others that we've seen. Your heart goes out to them, and just hoping that the crest of this wave comes soon. Back to you guys.
Miguel, that's an incredible report that you just filed there. Those are remarkable images. The people lining the hallways there jumped out at me. Is the lack of protective gear noticeable?
It is. So the doctor that we interviewed, that was a surgical, paper surgical gown. We felt a little embarrassed once we got there because we had sort of the proper Tyvek, the white hooded gear with goggles and masks and the boots, everything from head to toe, gloves. They looked at us as though we were space creatures. They were like, that's what we should have. That's what we actually need in this situation. I mean, they have thousands of employees, everybody from the doctors and the administrators of the hospital to the people who sweep up and dump the trash out. I mean, all of them just as important as the other to keeping that entire organism going. And they are desperate for more gear. You know, some of the folks that we spoke to, they stop off at Home Depot, they go to eBay, and they buy it online in bulk as often as they can and bring it in, you know, paying retail prices basically for stuff that they just cannot get.
Look, I love you, Miguel. I'm glad you had the right gear on, but you shouldn't have better gear than the doctors and medical workers and nurses on the front lines. That speaks volumes to the supplies that they have. How are the other hospitals around the city and the country providing help at this point?
I mean, everything that we hear from other hospitals is it's much the same. They are moving toward that max point. They are moving toward, they're dealing with all the regular trauma and all the regular cases that they have, and COVID-19 is moving them to a place where it is going to overwhelm them. The ICU center that you couldn't really see much because they have it sort of blocked off in this area is completely maxed out. They barely have a bed left in there. They have about 65 ventilators. They have a few left so that if people need them, but all of those people that you saw shoved into the hallways there, they are basically in the emergency department, and they are waiting to be assessed to go up. They've all been admitted, and they're waiting to either go to ICU, a regular bed, on a ventilator. They're trying to work through the worst cases. It is a triage at this hospital and others that is only going to get more brutal as the days go forward.
Miguel, this is such an important look that you just gave us inside this fight at the front lines. These are pictures we haven't been able to see before, and I think it informs how all of us will think about this battle going forward. Miguel Marquez, thank you very much for your work, and your crew for being brave enough to do that.